Hello everyone, we are posting our video journal for week 10. We have to answer few questions um, regarding our experience throughout our clinical journey. The question was, what goals did you set for yourself at the beginning of the semester and did you meet this? Um, I think I have met some of them. I actually set myself um, to do the proper assessment or evaluations. I want to um, find out during the assessment how the patients are behaving and what are the symptoms I should be looking for. um, that was kind of my goal, and also the medication management, how they are starting and medication after admission, or how they are managing the symptoms by starting and or tapering off other medications. So that was kind of my goal. I did meet some because of this is a JD psych unit. Most patients are comes with dementia, so that was majority of the um, illness we have found. So yes, mostly we have addressed the aggression or agitation stuff like that. Yes, I have met some of them. What feelings and prejudices and biases did you experience during your clinical experience, and how did you manage them? I think uh, I have been working in psych units for significant amount of time, so I am kind of used to this setup. Definitely, we all have our biases. We think, oh, how why their patients are behaving like this, and they should not be like. Sometimes like feel like, oh, this is very funny, but why the patients are very paranoid. So we have to, if you think in terms of patient's perspective, it is very unfortunate that they are going through this tough times. So yeah, have um, I had like those biases, and before, like you had to understand why their patients are behaving like this is not easy to understand most of the time, and not to rationalize. So yeah, in the beginning when I started working in psych unit, so it was kind of tough from transitioning from med surg unit to psych. So but during my clinical experience I didn't have that much of prejudice or bias, because most of them are very sick and I know they are very confused, and mm, they don't know why they are very aggressive or they cannot rationalize. So I understand that stuff. So that I didn't have that much of bias when I started my clinical here, because I've been working on psych units for a long time. um, but I just, even if I have some in my unconscious mind, me questioning myself why the patient is behaving, just trying to put myself in their shoes. If I was in that situation, if I had that kind of feeling, why I would have been acting. So I think like that, and then it helps me to understand their issues. How did you manage your anxiety and self doubt? Yes, couple of times I had the anxiety because you could not maybe manage the patient behavior, or mm, the when you are expecting the right result after giving a PRN, and we are not getting enough expected result. um, I kind of anxious about that part, because when you discuss and start any anti-anxiety or anti-aggressive drugs on patient and it's not working, so it's kind of um, gives you some self-doubt. So that was anxiety, but I discussed with our psychiatrist and nurse practitioner. So you kind of try to address the issue, talk with the patient, and change medication, and try slowly to offer of other, and most importantly try to find other causes. Sometimes there are some triggers that may be causing the um, patient aggression. So we also try to find what could be the cause, and talking to other more experienced nurses also help. What understanding or insight did you develop during our clinical experience? um, Definitely, it was a good experience for me in terms of what happens regarding patient management, patient transfer, discharge, and admission plans. Those parts I was not aware of, how social worker and case managers work. So that kind of understanding and legal stuff was very interesting, and I was not that much aware of, because the shift I work, I was not exposed to that kind of experience as such. So it was kind of good experience for me. I think that will help me to understand the legal jargons regarding a patient discharge, who will be the healthcare proxy, who will be the charge of the patient care at home or after discharge, and how we can discharge the patient, or um, discharge the patient to home or to the community. So finding a placement is a big issue here, especially this old age group. Has reflective practice impacted your as a person, student, or provider? Yes, definitely. As a person, as a student as well. um, if you do reflect your actions or your thought process, definitely help you to grow as a better person. It helps you to um, mm, know more, um, uh, increase your thrust of knowledge, question your um, ability to ask for more is definitely mm, helpful. um, will you continue to use reflection in your future practice? Definitely, if you reflect your actions or your thought process, it helps you to be a better person and better evaluator as a provider. If you do that, I think I could be a bit better uh, provider in future. So it definitely will help me um, if I do a self reflection, my future practice. And that will be all. I hope you have a great summer vacations. Thank you so much.